Welcome back to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's example is a young cat of unknown age who has been missing for 2 days and has now come home severely lame. Friends, this is a hard one to look at. What a horrible injury. Here I will give you a chance to look at both views of the right hind limb centered at the stifle region. So we can all see that there's a horrible fracture here with substantial displacement. I wanted to use this as a chance to practice fracture description. It's nice when we can compose a succinct sentence about a fracture, even a fracture as dramatic as this, so that we can discuss them on equal footing. I like to compose the sentence with the following components. First of all, I start with the location, which is usually just simply the bone that's affected. In this case, I'm going to say in the distal femur. And in addition to commenting that it's the distal femur, I'm actually going to include the word physis because this fracture, I'm going to pop to the CC view to show us a little more clearly. This fracture is involving the distal femoral physis. The fracture type is the next thing that we would assess. Salter-Harris fractures have their own classification scheme. Essentially, when you have a fracture that goes right across the physis like this one, the next thing you want to look for is if there's any fracture extension up the metaphysis or towards the epiphysis. In this case, there's maybe a little bit of involvement, going back to the other view for a second, of the metaphysis. So we would call it a Salter-Harris 2. If it, instead of going to the metaphysis, went to the epiphysis, which would then make it an articular fracture, that would be a Salter-Harris free. Salter-Harris 3. The next thing I look for is comminution. Although a highly comminuted fracture is its own type, most fractures have some elements of comminution, characterized by small fragments on the edges of the fracture. So I would say in the distal femoral physis, there is a Salter-Harris 2 fracture with minimal comminution. The next thing we describe is fracture displacement. Of course, it's jumping off the screen at us. This is what I would categorize as severe displacement. And we then characterize the location of the distal aspect of the fracture relative to the proximal. So the displacement would be severe, and you can see that on this view, it's medial. And using the orthogonal view, the displacement is caudal. Well, so severe caudo-medial displacement. It's a really important when we have a dramatic lesion like this to not stop once we've composed our beautiful fracture sentence. You want to continue to practice the ABCDs on the rest of the images. Remember, when you're imaging animals that have had potential trauma, you're always going to catch a little bit of the abdomen, for example, when you look at the pelvis. So you want to make sure that you assess the bladder. Any concurrent injury that the animal may have could definitely affect your treatment plan as well as the prognosis. So, to summarize my sentence for this fracture, in the right distal femoral physis, there is an open Salter-Harris 2 fracture with minimal comminution, severe overriding, and caudomedial displacement. 2 words that I used in my sentence that I didn't touch on yet. The first one is open fracture. I concluded this was an open fracture because on this view especially, the fracture fragment comes very close to the skin surface, and additionally, you can see that there's a little bit of gas within the skin. Although radiographs are not the most sensitive way to look for an open fracture, if you ever see a situation like this where the bone comes right to the skin surface, or even if it doesn't and you see gas within the soft tissues, you should always suspect an open fracture. Physical examination, and in some cases it requires clipping the limb around the fracture, is really going to be one of the more accurate ways to tell whether a fracture actually has punctured the skin or not. So the other term that I used was overriding. I tend to use the term overriding when I think that not only is the distal fragment of the fracture displaced from the proximal fragment, but they've actually come together so that they're now almost superimposed on each other. So that would conclude my fracture sentence for this case. In the next week, we're going to look at how this fracture heals over time, and I can't wait to show you how it comes together. Thanks for listening, and remember, it's your case, so please post your questions on social media.